.ca.gov. For months now, the CDC has been stressing the importance of face coverings in the fight against COVID-19. Some states are seeing evidence that mask wearing may also have limited the impact of the seasonal flu this past winter, which raises a question with particular relevance to Kern County. Could mask wearing also have helped slow the recent steady acceleration of valley fever cases? 17's Robert Price explains.
Several studies have confirmed what many of us know intuitively. Face masks help protect against a virus that has killed more than 500,000 Americans over the past 14 months. But could masks have additional health benefits right here in Kern County, such as fewer cases of valley fever? At this point, it's pure speculation, but maybe. We know this: Kern County had a 41% decrease in valley fever cases from 2019, when essentially no one was wearing masks, to 2020. When, for the latter 9 months of the year, a substantial percentage of the population was wearing masks and/or was significantly curtailing social interaction. Valley fever, a debilitating and sometimes deadly ailment caused by an airborne fungus common in the southern San Joaquin Valley and southwestern United States, had been steadily gaining traction here since 2014. That year, Kern County had 106 cases per 100,000 population. By 2019, Kern had a whopping 367 cases per 100,000, a gain of 260% over 6 years. 2021 looks to be even better than 2020 in terms of limiting valley fever. So far in 2021, we're on track for a further decrease of 10%. Valley fever cases ebb and flow based on a number of environmental variables. But could mask wearing or the general lifestyle changes wrought by the pandemic be one of them? Dr. Royce Johnson, Chief of Infectious Disease at Kern Medical and Medical Director at the Valley Fever Institute, says it's possible.
I'll include the masks, but not distance. Social distancing doesn't have anything to do with it. Staying indoors and wearing masks probably both could have an effect on the numbers. Now, whether that is, in fact, what affected the numbers, I can't tell you.
On Sunday, Dr. Anthony Fauci, the nation's best-known epidemiologist, said mask wearing might be beneficial even after the pandemic goes away because it could help minimize the impact of the seasonal flu. Might it also have those benefits for those at high risk of serious complications from valley fever? Maybe so. The decline in valley fever cases could have as much to do with cutbacks in jobs where valley fever risk is highest, such as construction and the oil fields. It could have a lot to do with the fact that people just stayed away from doctors' offices. Most likely, it's a combination of those things, including the impact of these things. In Bakersfield, Robert Price, 17 News.
All right. Thank you, Robert.